Welcome to the School Mental Health Minute. This is a weekly webcast that focuses on mental health and school issues for children and adolescents. We'll highlight some of the newest research findings and translate the impact and implications of these findings. All this in a couple of minutes. I'm Dan Florell, and let's see what this week's study has to offer. We're featuring a journal article this week titled Stable Associations Between Behavioral Problems and Language Impairments Across Childhood. Several research studies have found that children with language difficulties often have behavior problems. These authors wanted to see if children with behavior problems were more likely to have pragmatic language difficulties 5 years later as they entered adolescence. Pragmatic language refers to using language appropriately within situations and being able to correctly interpret the meaning of the language within that situation. Children with behavior disorders such as autism spectrum disorder and ADHD often have pragmatic language deficits which can contribute to their social difficulties. The authors found that when parents reported their children to have peer problems and language problems, that it predicted those children would continue to have pragmatic language deficits into adolescence. This means that language issues experienced by children do not simply fade away as they get older, particularly in children with behavior problems. Rather, the pragmatic language deficits remain, which will make it difficult for these children to form good friendships and increase the likelihood of escalating behavior problems as adolescents. The takeaway is that language deficits, particularly in pragmatic language, are very common among children with behavior problems. When various treatment options are considered for these children, parents and professionals should include pragmatic language interventions along with behavioral ones. This will allow children to have the communication tools to form better friendship and have fewer behavior problems as adolescents. That concludes this webcast of the School Mental Health Minute. Come back next week, and thanks for watching.